The best thing a parent can give to a child is time. Okay, it's not money, or it's not buildings, or it's not, beautiful toys or cars, but time.
In India, they're learning multiple languages at the same time simultaneously, and they're developing cultural acceptance, things that are necessary, shoes off at the door, and how you treat elders, that you have the same respect. These things were instilled.
Hello everyone, welcome to another video of Elite Expertise YouTube channel. I'm Harika Bheemavarapu, practicing consultant pharmacist in Australia. I work as a clinical pharmacist educator for Monash Health Hospital in Melbourne. And Elite Expertise is an online training platform, a professional platform where we train pharmacists. But today, this professional talk is entirely like as a duty of care for me being a pharmacist. So I worked as a pediatric pharmacist in last few rotations at Monash Health, and I've realized that there are like lots of behavioral issues amongst children, teenagers and children, and I have seen a hike in autism diagnosis these days. And then speech delays, developmental delays, etc., etc. And as a pharmacist, I strongly feel that now non-pharmacological interventions like not starting the medication straight away, but behavioral interventions in children is the main goal to achieve a change in them. So, technically speaking, as a pharmacist, I have studied that unexpected increase in dopamine levels, surge in dopamine levels will cause psychotic behavior. People experience psychotic behavior, like even elderly, or, unexpected, like, surge in dopamine all of a sudden will cause psychotic behaviors. And in children these days, busy parents, we are getting addicted. They are getting addicted to TV screens and mobile phones, and parents are not able to spend enough time with their children, which is causing behavioral issues. And to treat that behavioral issues, parents are taking them to doctors, and doctors, yeah, I'm not judging anyone. As a healthcare professional, I get profit of selling medications, but medications are not the goal of any treatment, and at least for behavioral issues. So let me present to you. So this is a professional talk, completely not for profit, between Marci and me. So Marci is an angel. She's a healthcare professional. She's a speech pathologist and a behavioral therapist. And she's got overwhelming 30 years of experience. And she's got research on children, like, hands-on research on children. Like how we say, if we have any problem, we go back to our parents to ask, what's the solution? My child is behaving this way, that way. What should I do? And our parents come up with their experience. And Marci is a combination of being a speech language pathologist and a behavioral therapist and an experienced, a research person and an experienced mom as well. And she knows children's instantly, like she can study their behavior and change them instantly. And I strongly felt that I have to introduce Marci to all the community who knows us. So hi, Marci.
Hello, everybody. Thank you so much for having me. I'm very happy to talk to your audience.
So please tell us about yourself.
So you shared a lot. I am by profession a speech pathologist. The behavioral intervention for me happened as a result of the communication struggles of my clients. So they aren't speaking, these kids, and they're using behavior to communicate. And so my goal, my function, as I shifted away from being a clinical therapist and working in the clinical environment, is to address parents, because I believe that parents are the best, the first, and the best facilitators for natural development. And I believe that speech is a natural developmental process, and it certainly can lie in the hands of parents. So it doesn't make sense in this world where the parent has caused this extra exposure to videos or things like that, that when parents are equipped, empowered to take that responsibility back, then they facilitate the communication and the behavior changes naturally. We don't have to change the behavior. We have to help the child change the communication. And that's how the behavior changes naturally. And that's why it feels so magical because you're not making the child do, like most behavior therapies are all about making the child change, but we understand that you cannot make a child change. But you can motivate them to try new ways to communicate if it's fun. And that's my philosophy. If it isn't fun, it isn't fun. And parents are the best ones to find the fun because they know the kids and the kids know the parents, and there's no middleman needed to facilitate this level of development.
Yeah, very true. So I think Marci brings us closer to our children. Like, she she makes parenting so enjoyable experience. So my question to you, Marci, is why do you think these behavioral issues are occurring in these generation a lot? Like compared to when my parents were there, they were like very happy souls, enjoying, doing some farm work, enjoying staying with environment, enjoying the beauty of nature and like, having that work-life balance and raising 10 kids together. But these days we are able to raise one or two two kids together, and it's like parents are feeling overwhelmed, and so why do you think these issues are happening?
Well, I think it started when families started breaking up, right? It was one home, multiple generations, and even the in-laws or whoever was all living together. And like you said, in a home with 10 kids, it's not only the parents who are teaching the kids. They're learning from each other. They're learning from the aunties. They're learning from, all of those things. And so much learning happens before the child even goes into any kind of structured education, right? In India, they're learning multiple languages at the same time simultaneously, and they're developing cultural acceptance, things that are necessary, shoes off at the door, and how you treat elders, that you have the same respect. These things were instilled. So the first thing happened, those family households started breaking up and parents were left on their own. And what do parents on their own, where do they go? If mom is not in the next room or the next floor or whatever, or the auntie or their grandma, whoever, they go to Google, right? And on the Google, they're finding these autism lists, you see, because the behavior therapy, it's the new medicine. This ABA therapy is the new pharmaceutical, right? Because parents don't want to go back to those days of giving the kids the Ritalin and on the ADHD meds and those things. But the kids are acting even more hyper and more rigid and more consistent and flapping and showing these. Now the new Band-Aid, the new medicine is this ABA therapy. And I think parents are looking to the Google and to these therapists as experts, right? And they don't go back to the true expert, which is themselves and their even child, how much you're learning from your child when you are teaching them. You learn what they're capable of. You learn what they're not capable of. And if they're not capable of that thing, then you can go into your resources to help you learn how to help them. Instead of just saying, I can't do it, you do it. Fix my kid. Because these lists, these Google lists always say something's wrong with the child. And I say, before we think about what's wrong with the child, let's look at what's wrong with the connection with the parent, the one they need to learn from. And when that happens, the parent sees where they're disconnected. And of course, the parent naturally reconnects because that's what makes it nice, right? You want your child's time together to be happy and enjoyable. And you want to watch your child develop instead of make them do a thing. If they do that thing, put it in or do this or say the word or whatever, it's only helpful for you in that one moment. But when you teach the child to use that language functionally, and I use the capital F-U-N for functional, right? This is what you can do. And it's much easier than parents or even these internet things want to make you believe, because of course they're trying to sell therapy, And so this, again, is a message, like you said, a human message, a personal message, an important professional thing that I share on my channel every day with parents.
Yeah, so I think it's amazing how you're helping parents get back to their children. And like in my own words, what I learned from Marci is the best thing a parent can give to a child is time. Okay, it's not money, or it's not buildings, or it's not, beautiful toys or cars, but time. Spend time with children and they'll be fine. And you don't have to go into the cycle of starting a medication, because once you start a pharmacological therapy or medication, you're sending the child into a loop. Rather than that, like any healthcare professional would agree that behavioral interventions are the mainstay for treatment for any disease in the world. And it's amazing how, like, I think Marci has good certification courses for healthcare professionals, and like Indian doctors, are clients to her, where they get trained on how to treat children,
Right.
behavioral aspects of children. So, would you please throw the light on it, please, for us?
Yeah, sure. So my platform, instead of working directly with the child, I can be more impactful by educating the parents and even the doctors who are doing the diagnosis. So if you're a developmental pediatrician and all you have in your consultation moment is these checklists and these prescription pads, right? Because you don't have very much time. But Dr. Deepti, who is in India working with me, she has developed a really nice consultation screening methodology she's using just with toys. In fact, she doesn't want the parents to talk to her. Parents come in and they want to say, my child is doing this and this and this, or they're not doing this and this and this. And before she listens to the parents, she herself connects with the child. And I think it doesn't take long, just even a couple of minutes, right? Because they're engaging with the child not from a judgmental or diagnostic standpoint, but from a let me see who this child is. And then without thinking first, what can I do to prescribe this child? We look at what is it that got them to this point? Because in addition to separating families and not living in a house with a bunch of kids to learn from, parents are, just using these videos to babysit, because during pandemic, what could you do, right? You were working and building businesses and trying to feed your families, and you didn't have the household full of 10 people where you could pass them off to a mom or an auntie or somebody like that. So without someone, you pass them off to something, and you pass them off to the phone or the TV or something like that. And because those things are educational, you might feel a little better about that time that you spend. But the reality is, how will the child learn? How will this medicine or these videos or this whatever program help? It can't, because what it is trying to replace is the connection with the parent. And that's why we just always come back to that, when it really is much easier than people want it to be, isn't it? Harika, they want to make this such a complicated, you have to have these studies and this evidence-based things and these structured programs and these studies, double blind, blah, blah, blah. But the reality is every parent can look at your own child, maybe not everybody else's, but your own for sure, right? And you can see what the child is needing from you because they are telling you. It might not be with words, but it is with their behavior. That's what I look at. When parents send me a video, I see, what is this child needing? And I tell the parent, he needs more words from you. He needs more time from you. He needs more patience from you. He needs more, I can see what's missing, because from the outside, it's easier for me as the consultant, right, to take a look at that. But then every single parent, Harika, when you find out that what your child is missing is already within you, there's no need to pay for this thing or buy this thing or whatever. You just learn how to be who your child needs, and they will naturally connect with you. They already are. And in the reality, if you have a parent out there, if you're a doctor out there with a little one who is late talking, just spend a few minutes with this child, observing them when they come to you to communicate a message, even if they're dragging you around or taking your hand and putting it on the thing or bringing you the pan and the egg, right? Because they know exactly what they want and need. And what they want and need is parents to teach them the words to communicate those things, instead of just, oh, you want egg? I'll fix you egg. And in that moment, they could be teaching, but they don't know how, because they've been giving away the job to therapists and stuff. So that's what I want to do. Is if this video does anything for you, I want it to remind you how capable you are, that you don't need to even go to school to take a course. If you want to become official and help other people's kids, you can become certified in this, but the reality is you learn so much just from helping your own child. Speech doesn't come naturally as easily to them as it does kids 10 years ago who were the same age, just because the environment has changed outside of parents' control. So the real deal is you can take it back, that control and responsibility and guidance, and even facilitate the functional improvement your child needs. No need for hiring out therapies, and the progress is much faster because you're doing it every day at home.
So I think, as you said, I strongly believe, and like all healthcare professionals, strongly agree that behavioral interventions are the mainstay to treatment of any behavioral issues in children. Call it autism, or call it, psychosis or something else, whatever terms we are giving. They are just babies and they just need nurturing and they'll be fine. And if you're a parent or a healthcare professional who wants to go that extra mile to help the child really, I think Marci is for you. She's the one for you. And this shout out is not sponsored at all. And we both are voluntarily doing this today. So she has wavesofcommunication.com, her website, where she, facilitates healthcare professionals and parents, empowering them to get close to their children and solve their behavioral issues rather than, reverting to a pharmacological treatment, which is associated with side effects. I'm not saying it's wrong, but try a behavioral intervention first and then go to a pharmacological intervention. So thank you so much, Marci. Thank you so much for your precious time today.
Thank you for having me. And again, if you're a doctor and you see a child, whether it's yours or a client who comes into your office, the best thing that you can do is just to have everyone take a deep breath and relax. Parents are very, very worried. These kids are really late to develop. They're very worried. So just have everyone calm down and visit Waves of Communication. You can ride the waves of the energy and the connection with your child and see how powerful you are. And try it for yourself, and then it will be very easy to recommend to all of your clients.
Yes, definitely. And like these days, if I Google child plays in the water and it's connected to some other disorder, so stop Googling. Stop.
That's right.
Issues and connect your child with heart. Yeah.
Yeah, in fact, as a matter of fact, you can't even really consider a true autism diagnosis until you've done this process, until you've done some evaluation and really figuring out how much the environment has affected the child's development, because the environment isn't the same. It's not the same world that we grew up in as children. And we can do this. We can help these kids. And it doesn't take medicine. What happens actually in this process is you find out the children who truly need it, right? Because those who are not responding to this kind of connected intervention, then they need the next step of intervention. But without this trial, if you give the medicine prematurely, you'll never know for sure.
Sure, yeah. Because once medicine starts, the side effects kick on. And they'll go into some other behavioral issues, which needs another medication to treat. And it's just a loop, but it's just a cycle. So thank you so much for your time, Marci. Thank you.
Thank you for having me. Bye-bye.